Hello, everyone. Welcome to our discussion today about breast cancer screening and the metric we use for reporting this screening to various agencies. We're going to be talking about mammograms and how we record them, document them, and report them. So let's start with the measurement period. Our breast cancer screening measurement period runs from January 1st to the end of December 2018. And the definition for this measure is the percentage of women 50 to 74 years of age who've had a mammogram to screen for breast cancer. When we're looking at this metric, we want to understand who is included in the denominator and in the initial population. For this particular metric, both the initial population and the denominator are the same, women ages 51 to 74. You'll notice that this age is 1 year older than the metric before. We actually have 1 year in which to complete the initial mammogram for women turning 50 years of age. The numerator includes women who have had one or more mammograms in this measurement period or the 15 months prior to the measurement period. So we actually get a 2-year span of time in which to document a mammogram for our patients. There's an important exclusion we want to be sure to be mindful of and document when appropriate. It is for women who've had a bilateral mastectomy, who've had a history of a bilateral mastectomy, or for whom there's evidence that of a unilateral mastectomy either on the right or the left side. So let's talk about where we're going to find our breast cancer screening data within EPIC. There is a quality measure dashboard that lists under clinical, effective clinical care, the CMS metric 125 for breast cancer screening. EPIC reports our ECQM by quarter, and on this example, you'll see that we're looking at the UPC BMP adults, which happens to be the third floor of the Wausau Clinic. For this particular clinic, you'll notice that all of their measurements are in green, which means that they are past the into the green zone of this metric. So one of the things that we'll know is you can hover over the percentage sign under any of the quarter or year-to-date numbers to see additional information. And we're going to take a quick look at that. If you hover over that 66%, you'll notice that for this clinic, there have been 1,261 mammograms performed out of a denominator of 1,908. And the target measure is over 47.9%, and right now this particular clinic is running at a 66% year-to-date number. We're next going to look at how to find the individual performance for providers. If you will click on that 66%, you'll be given a choice of whether or not to look for providers in this clinic by this metric, and a listing of the providers in the clinic will be shown. If you highlight any of those providers, you'll see the numerator and the denominator for each provider, and you will be able to target how many more patients over the course of time that that the provider in the clinic would need to perform in order to increase that measurement. I want to also point out that under the health maintenance guidelines, you'll find that under the snapshot view within EPIC, and you'll see a listing of the various other health maintenance guidelines that are needed and their due date. For this particular patient, this mammogram was due after February 18th, 2016. So this quick view and the red letters will be a great indicator for providers, for medical assistants, for nurses in the clinics that a mammogram needs to be performed on this patient, either through a referral process, done at the time of visit, or for an outreach process. So let's talk about what happens if we don't find a mammogram in EPIC. One of the things we want to do is ask every patient when they're coming in for their visit, whether it's an acute visit or a wellness visit, if they've had a recent mammogram performed. Clinics do this through a variety of ways. Some of it is through a direct query of the patient during the intake process by the medical assistant. Some of it is some clinics have a nice little let us know if you've had any of these done posters posted in the exam rooms, and some clinics actually have a form that they ask the patient to fill out at the time of check-in to indicate if they've had a mammogram recently. Was a recent mammogram performed? Is it documented in EPIC? If those things are true, we're just going to update the external result, and the health maintenance guidelines will be updated. Or we're going to request a copy. If the patient indicates yes, that they had a mammogram performed recently, we'll request a copy from the performing facility. When that document arrives at our offices, we will scan the result in under media, and then we will update the external result. If no mammogram has been performed and the patient indicates that they have not had one recently, then a referral will be made for a mammogram to be performed. So when those mammograms are performed and they come back into EPIC, you will find them listed under the imaging. If it's directly performed at one of our Hillcrest facilities, you will be able to see the mammogram results, click on it, and this will be under the imaging tab. In some instances, a mammogram may have been performed at an outside facility, in which case, outside of the Hillcrest Health System, in which case the mammogram will be scanned and will be found under the media tab. Both of those count. Just remember, imaging and media are the two places you want to check for documentation of a recent mammogram. Let's talk a little bit about that exclusion we mentioned earlier. If you are in the Health Maintenance Guidelines tab, you can click on the metrics, the mammogram and this one, and at the top of this screen, you'll see the exclusions as well as some override data. We don't want to override this metric if the patient had a mammogram, has had a past mastectomy. We want to use the exclude function here to indicate that the patient has had, in comments, you'll use a medical reason, and then in the comments, you'll enter that a patient has had a mastectomy. If you accept that, it actually will take that patient out of the denominator for this metric. Just one comment real quick. The override would be if the patient refused to have a mammogram for this particular cycle. Meredith Maynard, Erin Campbell, Mary West have worked on creating a grid of all of the different metrics that are measured and where they're reported to. As you can see from this screenshot, breast cancer screening is reported in a variety of ways. It certainly is on the provider scorecards that are distributed on a quarterly basis. It's also reported for CPC Plus for CMS. This is a metric we will report at the end of each year directly to CMS via a portal. We also have a separate report that we submit to United Healthcare for CPC Plus. Humana, United, and Global Medicare Advantage plans all monitor breast cancer screening for their beneficiaries enrolled in their Medicare Advantage plans. And of course, it is one of the ECQMs for reporting in MIPS. So you can see that number of organizations, agencies, payers are interested in the performance of breast cancer mammograms. So one of the things that we're going to do is try to modify how we're doing our data meetings and our webinars. We want to try to focus on a particular topic for a period of time. We have heard feedback and have seen people struggle with this change in webinars or change in data meetings as we've tried to squeeze in this 2018 year a number of both cost and quality measures. So we're going to spend a little time on practicing our PDSA cycles and trying to really vet out the process. So beginning for this fourth quarter, we're going to focus first on breast cancer screening. So over the next 3 to 4 weeks, we're going to be addressing a number of issues for breast cancer screening. The first thing is in that PDSA cycle is to plan. So for our next data meeting scheduled for November 7th, each clinic will review their current data for EPIC, both as a clinic and by individual providers, and determine within your data meeting your goal for improvement, whether that be to improve by a certain percentage or to maybe bring all providers up to a near equal level of performance. Your team will decide on that goal for performance. Within that planning stage, we need to set up a time to educate providers and staff on both understanding utilizing standing orders for initiating referrals and making sure that everyone knows how to document both external mammograms and doing the exclusions. So that's one of the things that we'll work on for this next bit, and that will be our next goal, our next data topic for November 7th. So that concludes our discussion for today. I hope that you will refer any questions to your care managers or to me so we can help address those. And we're going to be talking about breast cancer screening and mammograms over the next couple of weeks. Thank you for joining us today. Bye-bye.